Thanks, Dean Brownell, for hosting us. We're really thrilled to be here, and we're thrilled at RTI to participate in this event. I should say, and I should repeat it at the end, go Duke in the March Madness, right? So I've been in RTI for, that is a little bit too loud, isn't it? I've been in RTI for about a year. I was at USAID as a Foreign Service Officer for 22 years, before that working in a variety of capacities. But my last job was working on issues of food security. I was heading the Bureau for Food Security, so I'm really pleased, given that experience and my interest, to have been invited to moderate this panel. And we have a very distinguished group of panelists, so let me start by introducing them. First, I guess someone who needs no introduction over here at Duke, but I'll do it anyway. Dean Kelly Brownell, who's Dean of the Sanford School of Public Policy at Duke. He is also the Robert L. Flowers Professor of Public Policy and Professor of Psychology and Neuroscience. He also serves on the Board of Directors of the Duke Global Health Institute. He's published 15 books and more than 350 scientific articles and chapters. He's advised the White House, members of Congress, governors, World Health and Nutrition organizations, and media leaders on issues of nutrition, obesity, and public policy. He was cited as a moral entrepreneur with special influence on public discourse in a history of the obesity field, and was cited by Time magazine as a leading warrior in the area of nutrition and public policy. So thanks for being on the panel, Dean Brownell. Next to his right, we have Jean Viescia, and Jean is a senior scientist at RTI International and is nationally known for her work in childhood nutrition, physical activity, and obesity. Dr. Viescia participated in the development and dissemination of the National After-School Association Healthy Eating and Physical Activity Standards, which have been adopted by national organizations serving millions of U.S. children. She focuses on fostering organizational changes that support health promotion in community settings, and published extensively on community and school-based obesity and chronic disease prevention. She holds a doctorate in human nutrition from Tufts University. And to Jean's right, we have David Spiro. David is the director of RTI's Asia Regional Office based in Jakarta, Indonesia. He provides overall leadership and management of regional strategy and corporate operations, serving a $300 million portfolio of programs. He's an international development career professional who's worked as country director in Indonesia for RTI and in Nepal for Helen Keller International. In his 13 years in Asia, he's worked extensively on education, nutrition, food security, and governance issues. He's a graduate of Colby College in Maine and the Fletcher School of Law and Diplomacy at Tufts University. And lastly, excuse me, we have Ghada Ahmed, who is a senior research analyst with the Center on Globalization, Governance, and Competitiveness at Duke University. At the center, she's developed and is leading the Minerva and Army Research Office funded food security and energy research in the Middle East and North Africa. She holds an MA in International Development Policy from Duke and a BA in Business Administration from the American University in Cairo. So welcome again, panelists. I believe we have a couple of maps, but let me start. I'm going to speak for just 2 minutes, and we really want to turn this over to the panelists, and thanks, and then have a vibrant discussion with our folks here. So I'd say that when we think about food security, food insecurity and obesity, they're traditionally thought of as opposite issues. I think historically people have focused on food insecurity as a problem for lower income countries, particularly countries in Africa, and obesity as an issue that we see in the upper income countries. But I think what we'll hear from our panelists is that we realize that these issues are increasingly complex, and that the phenomenon are not simply about the presence or absence of food. It's really, they're interconnected in complex ways. And I think our panelists are going to provide a lot of good information on how we explore how these two phenomenon relate to child nutrition in the context of upper, middle, and low-income countries. Now, just to give a little bit of context, do I press the right arrow here? Yes. So, I mean, you can see this is a map that's used in a lot of reports on this that gives you the global distribution of food insecurity. And not surprisingly, you see shown in red, orange, and yellow, the countries that are at highest risk of food insecurity are Africa, the Middle East, countries in Asia, and Central and Latin America. where with, in particular, Africa and South Asia being at highest risk. And you can also see North America, Europe, and Australia are the countries at lowest risk of food insecurity. So that's not a huge surprise to people. And if I show like my own very last slide, so we can get in here, the global prevalence of obesity. Now, I didn't have the technical ability to overlay these two maps, and I think the colors would have gotten too confusing. But also, as expected, you could see higher rates of obesity shown in red, orange, and yellow in North America and Europe. And conversely, the lowest rates of obesity in places in Africa, India, particularly Congo and Chad. There are, however, some countries where you start to see what we refer to increasingly as the double burden. Latin America, South Africa, the Middle East, particularly the Arabian Peninsula, where you see relatively high rates of overweight and obesity, and from the prior map, high rates of food insecurity. So we're having increasingly globally this conversation about the double burden of malnutrition, and that's launched lots of additional research. The last point I'll make before I turn it over or start to ask the panelists questions is trying to limit this. I showed these two maps with some national statistics, but when you look nationally, it hides a lot of the details. So there's a lot of stuff happening within these countries. There are differences within communities, differences at the household level that are not borne out by this. And in particular, countries such as, there are 5 countries, Brazil, China, Mexico, Indonesia, and India, which don't show on the prior slide high rates of food insecurity, but given their populations, those 5 countries alone account for almost half of the food insecurity globally, and they also are countries with either rising or high rates of obesity and undernutrition. So those middle-income countries present a particularly difficult challenge. So let me start asking some questions so we can have a dialogue. I'm going to start with a softball question before I turn and go for the jugular to make this interesting. I'll ask all of you the same question, but start with Kelly. So given the complex relationships that we see between food insecurity and nutritional outcomes, what do you see as the critical factors that link food insecurity, child malnutrition, and obesity based on your work? What are really the factors driving this double burden?
Well, to begin, there are biological co-occurrences that link childhood malnutrition to obesity. So you may know that children who are malnourished early in life are at greater likelihood of having obesity and diabetes and other diet-related diseases later in life, probably because of a metabolic imprinting that occurs early in life. So people don't often think of malnutrition causing obesity, but it appears to be one of the causes, and this would be especially acute in the developing world, of course. I think the other thing that links the two is a food system that doesn't work as well as it could. And the world now produces enough food to feed its inhabitants, but that won't be true for too much longer, sadly, unless something pretty dramatic changes. But the fact that we have low-cost, highly processed, and calorie-dense foods in developed countries and more in developing countries, the fact that we can't get good, healthy food to people who are undernourished and need it, are all consequences of a food system that's just not working well. Food waste is a big issue. The fact that there are refugees and wars and other political issues that keep food from people who need it really create a problem. And this food system that's under great stress now will only become under more stress as time goes on, because the statistics suggest that in only 50 more years, world population will double. And I haven't seen any agriculture estimates that will be able to keep up with that. I don't know if we can genetically modify our way out of that problem. I don't know if climate change will provide any help by making Canada and Siberia all of a sudden, places where vast amounts of food can grow. Who knows? But right now, we don't see anything on the horizon that will help solve that problem. So some pretty dramatic changes, I think, will need to be made.
Thanks, Kelly. Gene, do you want to jump in here and continue on this theme of the linkages between the complex issues of malnutrition, food insecurity, childhood obesity? Maybe from the U.S. perspective. Where
Sure. Yeah, it's hard to add to that. So thank you. But one thing I did want to say was that when we talk about food insecurity, it's in some ways it's a proxy for a range of different difficult situations and coping behaviors by families and individuals. And so, although it's sometimes hard to conceptualize how do we have food insecurity and obesity, behind the food insecurity, of course, are social determinants of poor access to food, as well as structural determinants of that. And individuals in poverty, low education, et cetera, or poor access to food, often resort to coping strategies, particularly in my experience in this country, that can promote very poor dietary choices. And to call them dietary choices is probably an exaggeration, but when you don't have a lot of money, you're going to buy what you can, and when you can't predict if you're going to have enough money to last through the month, you may load up at certain times. So decision making in those families may not look like it's rational outside of those households, but within those households, sometimes that's all that people can do. And I think it does drive, it starts to explain this link between food insecurity and obesity, that you end up with people who have sort of disordered access to food and have to make decisions that don't look good from the outside, but they promote obesity.
Yeah. So I thought it would be good to get a little bit of each panelist's thoughts on kind of these factors driving these causes, the relationships, and then probably after that we turn to issues of policy responses. But David, I mean, you work in Indonesia, you've worked principally in Asia, but in a variety of countries. Do you see kind of commonalities between the kinds of issues on these choices at the household levels Gene's talking about in the United States, or is it a very different picture when you go to the lower income countries?
No, I think there are a lot of commonalities. I mean, I tend to look at it at a very base level of, the quality and the quantity of caloric intake, and then work out from there. So looking at the household levels, what are the driving social factors around that? In some countries, it's gender issues. In other countries, it's income. A good example of a gender issue would be, in rural households in South Asia, a lot of times the youngest woman, who is the woman of childbearing age, is the last one to eat, and therefore gets the least quality food at the dinner table. Well, if she's pregnant, that's going to impact that critical age range of, -9 months to 24 months and the access to nutrition that she has. So that's a household level. But then there's, availability and accessibility, and eventually, education issues and things like that. And I think there are commonalities. I think the approaches need to be different. But I really do agree with Kelly that there's a critical point early on in life where behavior at the household level, even before birth, during pregnancy, that is just really critical to what's going to happen to that child later on in life, both in terms of, obesity or not obesity, but also workforce and how they're going to be able to succeed later on in life. But the point you made about food systems is really important, and I think sometimes we don't pay enough attention to the various political economies and incentive structures that are in place in private sector, in policy making on the government side, and also at the household level, and oftentimes where those political economies contradict one another, and how do you resolve those contradictions. So I tend to start at that very individual, what are they intaking and what's the quality and quantity of that, and then look at the social dynamics around that.
So Gada, let's kind of bring you into this conversation. Do you have additional thoughts on these issues of the linkages and factors that drive this across low-income countries or middle-income countries?
Well, I think Kelly and others here have just really done a fantastic job talking about this. From the point of view of the research that we are doing, what we did is we took the 4 quadrants that make up food security, so availability, access, utilization, and the security of supply. And then we wanted to take sort of a food systems approach to unpack what's happening in each of the commodities that are considered critical to households. And one of these, for example, is bread. That's considered one of the leading indicators of food security for households in many countries, especially in the Middle East and North Africa, and also considered an indicator of stability, of social stability. And what we did is we unpacked these dynamics, what's actually happening in a system on an input-output basis. And interestingly, when you look at this, you start seeing the linkages from a slightly different lens to uncover not just the linkages, but also opportunities and challenges and how you can do that. So how you can address these challenges. So one of the things that we found is the approaches towards providing food, because economic access is so important on a household level. What we found in the subsidy system in many countries in the Middle East and North Africa has made the availability of multiple food items at a very low cost. The problem is that this has been done in a way without really looking at the utilization aspect of food security. So what you end up seeing in these countries, you find things like child stunting that went from that's like at about 31% of children in Egypt have now a problem with child stunting. In Upper Egypt, on the other hand, it's towards 39%, where there are higher levels of poverty. So you start seeing the linkages between how people are eating based on what's available for them at a very low cost price. So bread is one of these items. And we found that low-income families there, because of what's been called now, shifted from the double burden issue to the triple burden, meaning you have child stunting, which is now being more and more being used as an indicator, a little bit away from malnutrition, obesity, and also the non-communicative diseases that have evolved as a result of this and are growing in countries in the Middle East and becoming a serious problem. And we found from this that the governments there are promoting low-cost food, and this low-cost food is available to low income, but also it's available to high income. So in low income, you'll find child stunting, you'll find obesity among mothers, regardless of the income level. You'll find some very similar trends. And so one of the things that we are looking at is, why is it that as you're looking into the subsidy system and providing food, why not also provide better information on nutrition and utilization of the food so that you can promote better health outcomes?
So there are a lot of great issues we can explore that you just raised. I jotted down a whole bunch. So let's start with just one, because there's one little thread that you said that reminded me of a point Kelly made about kind of the production issues that if global population does indeed get to 9.6 billion by 2050, we'll have this big issue of how do we simply feed people. And some governments' responses, of course, I think some of the issues you raised about government response to food insecurity is subsidized bread. What I fear, of course, is we know that doesn't work. I mean, if you're just giving people large amounts of starch and worrying about simple caloric intake, which you can fill mostly from carbohydrates, you don't get the kind of nutritional outcomes we want. So the thing I fear hearing these production issues is it will force a global dialogue back into that framework. We just simply need to fill bellies, which doesn't solve the problem. So I don't know if you're nodding your head, Kelly, you want to jump in here and add some flesh to the bones of what I'm stumbling through?
No, I don't think you're stumbling through it all, Paul. It's a very acute problem that the amount of calories that can get introduced into the world food supply is massive, and it has been massive, but it doesn't necessarily mean that the quality of the diet is high. And so you can have people who have adequate calories but are undernourished. You can have all sorts of combinations of these nutritional maladies that affect people, and they depend a lot on what world food policies are and what domestic food policy are as well, as several people alluded to. So these things have to really be considered very seriously. And you could just take for example, what will it cost in terms of environmental damage to feed all those people that will be entering the world's food picture? And the meat production will go up just by definition, even if the ratio of meat consumption now stays the same. And it doesn't appear that it is, with meat consumption occurring a lot in some countries. But that'll put great stresses on the climate. It'll put great stresses on water supplies and all sorts of other things. And so that's why food policy, I believe, has to be considered in light of environmental policy, education policy, health policy, and a lot in foreign policy. All these sort of things are all affected by what we decide to do about food. And if people can begin thinking about food as those types of policies, I think more bright and talented people will pay attention to it, and will try to avoid what I think has occurred with food policy so far, which is the equivalent of the old whack-a-mole game, that you want to intervene with hunger, so some NGO puts a lot of money into dealing with hunger, and governments do, and so you whack down that one mole, but then another mole pops up somewhere else on the environmental side, let's say, or the obesity side. So seeing all these things together in a holistic way, I think, would take us a long way toward helping solve them.
Complex ecosystem. So, but you also mentioned NCDs and the growth of NCDs. It's obviously a growing problem that policy is in many ways contributing to. I think this is Kelly's point. We're trying to solve hunger, filling hungry bellies. Are we creating problems for the healthcare system through NCDs? Jean, do you have who wants to jump in on that? I'll stop calling on people. Let's just have a conversation.
Thanks. I'm happy to talk about that a little bit. When we talk about obesity, obesity itself is a risk factor for these chronic diseases. And I think it's really important to put it out there that what we're worried about is the potential increased risk that comes with obesity for these chronic diseases that have terrible consequences for people who develop them and for the economies that are taking care of them. And in the Middle East, of course, there's a tremendous diabetes epidemic and a healthcare system that isn't equipped to take care of it. So you imagine the impact on individuals who are poor and have little access to the healthcare system and have frank diabetes and may be facing amputation or lifelong infection problems and can't work. So, it becomes a really serious issue. So I think that when we talk about obesity, we should always keep that in mind, that we're worried about the risk that it increases in people. And when we talk about the food systems and the policies that, as Kelly was mentioned, we have to think about this whole picture of how they're interrelated, because in the U.S., we're now reaping what we sowed, literally, in the sense that, a lot of food policy decisions made 40 years ago did a lot to increase the availability of very cheap calories from solid fats and sugars. And here's where we are with that. We're still waking up every day to new research about the dangers of sugar and carbs on inflammatory processes. So it is complicated, and we have to think ahead and help. I think it'd be great to use the lessons that we've had in this country to guide what's going on in other countries that are going through that nutrition transition, to think about it all together and don't just work on increasing soy production and not think about, not assume it's not going to have downstream consequences for people's health.
Yeah, I think that's a really good point. I mean, you both made really important points there. One is with NCDs particularly, the system is in a lot of these countries, not just the Middle East and all across Asia, is unable to handle it. And had a unique example in Indonesia that kind of gives you an idea of how this all rolls out and can end up in something. Indonesia has the largest backlog of cataract blind in Asia. 2 million people are blind because of cataracts. It's like something we don't even think about, right? They can't work. They're home. And so I was working with a bunch of folks out of Johns Hopkins and a few other places, and the biggest reason that, first there was access to surgery, but then when we were able to increase access to surgery, the largest reason that we couldn't get people into surgery was because of hypertension and the lack of access to nifedipine, which would bring it down. And that is directly related to a more sedentary situation and the diet that they're eating. And so it just starts rolling out. And so you have a health system that can't provide regular medication for hypertension, so they're not getting surgery. Who's going to pay for that? Well, they're not changing their diets either, so the situation just keeps propelling itself, and you don't have a health system, and you have 2 million people being unproductive for really the wrong reasons, right? For things we know how to resolve. And so the system's and that's just one example. If you were to magnify that out, the inability of our public systems to handle it is just a huge risk that along the NCD, kind of spectrum will play itself out in, well, all these countries, you know.
So, kind of want to try and shift us to policy responses, because you guys are scaring me with the problems here. So we've got, middle-income countries moving up. Indonesia, I think, is a great example. We're seeing the same thing in Brazil and India, as people were all conquered by sugary drinks, and we're seeing this growth of factors that are driving non-communicable diseases. Do we just have to accept that? And we have these countries don't have the ability to have the healthcare system that we have in the United States to treat it at the end. What are some effective policy responses to try and deal with this, or is this a foregone conclusion? Kelly's nodding his head vigorously here. So you want to jump in?
Well, there are lots of things, of course, that have to be done, and I'll just take one of them as an example. So how to interact with the food industry becomes a really very interesting issue in this context. And is the food industry helping or hurting on the food systems front? Well, they're doing both. On the positive front, the food industry has been stunningly successful at lowering the cost of food and being able to get as much out of an acre as they possibly can. Now, there are lots of externalities that have occurred through that people are not paying for in the food we buy, at least in this country. But it's a very interesting set of things the industry has done. So their technological advances and their ability to bring foods to market in a safe way and low-cost way, it has been unprecedented. So they're very good at that. But there are some consequences of thinking of food as a commodity, of course, and trying to produce vast amounts of commodity crops that then go into processed foods that are having a negative impact. So there's this very interesting question about, can you work with the food industry, or you need to bludgeon them with public policy? And some people say the food industry is a lot different than the tobacco industry, for example, because you don't have to smoke and you have to eat. And if the food industry went out of business, we'd all die. So the parallel breaks down in some ways. But I think the behavior of the food and tobacco industries has been remarkably similar. And if the food industry wants to sell as much as it possibly can, it wants to sell the things that people are going to eat the most of, and those tend to be the highest calorie-dense foods and the ones that thwart the brain's natural satiety mechanisms and probably create some sort of an addictive process, especially with sugar. So I think there are areas where we can interact in a very favorable way with the food industry, and other areas where I think government really has to get in and intervene, because it's contrary to the food industry interest to have people eat less food overall, and at least with the obesity problem, that's going to be necessary. So those are some very interesting policy things that have to be thought through.
I don't know if someone else wants to jump in. We've got kind of higher level policy approaches governments need to take. There are also household and community responses. Who wants to, Goddard, do you want to jump in here?
Well, I want to add to this is that one of the interesting things about using the global value chain approach when you, in order to address the policy options, so for example, on the input side, when you start recognizing certain companies, for example, that are producers of seeds or fertilizers, then you start identifying the kind of companies you need to work with in order to protect the environment, or how you push towards a bit more environmental or more safer technological advances of that sort. But also, as you go towards what we would call the middle part of the chain, the processors, and what they do, some of them just move the grain. And when you get into some of the commodity that we're using every day, but we are unaware of what we're using, how we're using it, if it's bread and cookies and pasta, or the uses of grain, then we're entering into a very complex market, and that's where trade policy, for example, can help a lot in order to prevent a bit more of the collusion or the potential for collusion, grain price hikes, market manipulation, and some of these things has been very difficult for international organizations to sort of pinpoint right now, but what's very clear is that very large firms are in control of movement of multiple grains. Then in addition to that, as you move further in the chain, then you start identifying the uses, or how these grains are being used. And then you start facing a very interesting reality that we have competing uses for grains then, and this in turn impacts the availability of food, but also impacts the prices to which they're available. And so looking at the companies like Cargill, for example, that's is buying grain, corn, soybeans, and so forth from farmers and moving it across oceans in order to provide the grain to countries, but it's also involved in higher value processing, but also involved in biofuels and some other activities that impact the health outcomes. So food security ends up being an outcome of how the system works. So as we identify policies, we have to think about how this system is working. The banking system and how it works with us. There are definitely a lot of areas where regulation can be imposed in terms of the trading activity and commodity markets to help protect importers and also consumers of the grain. And then, of course, on the consumption side, as we identify the marketeers, the supermarkets, the shifts in how we're consuming food, it's not only limited to developed economies, but we're seeing it more and more prevalent in developing countries, the Carrefours, the Tescos of the world, and so forth. These are becoming common ways of how people are accessing food. So being able to work with these organizations, these companies, to promote better and more responsible health choices, I think are very important.
So we need, I hear you and Kelly talking about the need for these upper-level policy responses to encourage the food industry as a whole to produce better quality food. How do we get people to eat it though? People are used to eating, they want their Coca-Cola, right? The photo for this event has, I should go back to, I think that photo says a great deal. I've seen that in many parts of the world. That's the reality, okay? So people want their Coca-Cola, they want their whatever, their Twinkie. I guess Twinkie went out of business, or whatever it is they want.
Those Twinkies are still around.
Twinkies are still, they'll be here when we're all gone.
Can I take that?
Yes.
Yeah, so a lot of the work that I do in the U.S. has been around changing policy and organizations to change environments for children. So how many people here had a sandwich for lunch? Yeah. How many people had pizza for lunch? Yeah. Why did you have a sandwich? Because it was here, right?
That was a trick question.
That's my point. So, when organizations decide what they're putting in their environments, it influences what people do. And it's somewhat invisible a lot of the time. You think you're having a choice. You had a choice between turkey and ham. Sounds like a choice. It wasn't a choice between a sandwich and a salad or steamed greens, brown rice, etc. So policy can be at the national level, it can be in the public policy realm, but it can also be organizational policy to change environments where people live, work, and play. And I think that's a very important lever in environments where that, in a sense, where that luxury exists, where you can have those decision-making processes. And just to tell us a quick anecdote about how effective this can be. So in my work with after-school programs, we developed voluntary standards for healthy eating and physical activity, what foods to serve and how much physical activity and what types to offer and how to build infrastructure around that, we developed through a consensus building process, public health consensus building with the right people in the room at the right time. And that was a few years ago, and we've now had commitment from, we have about 13,000 sites around the country, after-school sites that are using those standards, and some of them have joined with the First Lady's commitments through the Let's Move and Partnership for Healthier America. And the estimate is that by 2019, 5 million kids will be in environments where those policies are in place. So that's another way you can move the needle on behavior. And it cuts across income levels, right? So a lot of kids in after school are low income. And giving them a healthy snack after school is really important, and it may even be a healthy snack and a healthy supper.
So I promised David I would go for the jugular with him to make this
great.
interesting. So I think for me the ultimate question is internationally maybe more than, or maybe in the United States as well, how do you address food insecurity, hunger without promoting obesity?
Yeah.
And the responses overseas tend to be lots of projects that do great things in 1, 2, 10, even 100 villages. How do you get it to scale? Is there a disruptive solution? In international development now, everyone likes to use the word disruptive.
Yeah.
We're all looking for disruptive solutions, borrowing from Silicon Valley. Or is it just that difficult business that the health field has tended to do by scaling out health responses, going household to household and doing behavior change?
So, I do think, it does come down to behavior change, and it comes down to understanding what those learning pathways are. We throw the term behavior change around like it's an easy thing to do, and it's not. you know, when I'm doing behavior change work, you know, and if I'm looking at adults, I want someone who understands how adults learn in that particular context versus how a child learns. So I think that's part of it. But I also think the international development community, you know, harbors a good amount of the blame. We need to start looking at, you know, projects that aren't on 4-year, 5-year cycles, but that are on longer, you know, 15, 20-year cycles where you can really start evaluating impact and look at what replication actually looks like, and not just say, oh, you know, hopefully it'll sustain itself and, you know, it'll move forward. I think we need to be smarter about how good interventions are replicated, and to go back to something that Kelly said, that how do you tie those interventions into a holistic approach, right? We've got a lot of great NGOs and development partners and others out there working, doing these kind of separate interventions, and they do, you're right, they do 10 villages over here and 10 villages over here, but they're not connecting the dots, right? And so unless you have, did you use the whack-a-mole, is that what you were kind of using? That's a really great visual, because that's what it is. And so you need the development partners and the host country governments and the communities to start looking holistically, and then have stronger evaluation and time to look at what it actually takes to replicate. To me, that's more what it's about, and you can't do that on a 4-year, 5-year cycle.
You know, Paul, when you were talking about household to household things, what it did was put this tension in my mind between individual level or small group level or even community level interventions to try to teach people to change their behavior versus policy things that really work at the level of the food supply. Now, of course, you'd like ideally to do both, but the problem is who's going to put up enough money to do the education that would take to counteract that image of Coca-Cola right there. No amount of money can do that. No government's going to be able to put that up. No government will outspend Coca-Cola in order to educate people to eat a different diet. So that's why I think policy is just such an important way to go. And so Jean's example was fantastic. So, you know, all the time and effort that went into creating the standards for after-school programs could have been put into educating individual children to change their diet and to go back to the family and work with them. Or you could work on the policy that affects vast numbers of people all at one time. And so that's why I think it's so important. So one statistic that highlights this is by far the largest funder of work on childhood obesity in the world now is the Robert Wood Johnson Foundation, and they're still spending about $100 million a year on childhood obesity. So they've been an absolute godsend for the problem. But the food industry spends $100 million every year to advertising junk food just to children by January 4th. They've already spent $100 million. So you can just see that it's a David Goliath type thing, and it's very important therefore I think to work through policy rather than to expect that education type approaches would work. So if I was a food industry executive, I would jump with glee every time I heard education brought up as a way to help address these problems, because I could outspend them like that.
So, of course, good nutrition, though, depends more than just on the diet, right? I mean, David, why don't when I bring you in again, or Moscato wants to come in, because there are issues of exclusive breastfeeding, issues of access to potable water, supplements. There's all kinds of complexities that we haven't gotten into yet, some of which are infrastructure issues that are hard to address at this level, some of which are these behavior change educational issues around breastfeeding. So how do you pull, it's so complicated, how do you pull it all together?
Yeah, I mean, you're right. I mean, I've spent a lot of my time on infant and young child feeding programs, and you know, I think, Kelly, you're right. There is, you know, ideally you can go with policy, but I think there's certain environments where policy doesn't get down to the community level. The government structures don't have the ability to get down to that decentralized community level, and so you can pass a policy on the national level and it's going to sit on a desk, right? And so you still need to find those vehicles to get it down there. And I think, you know, I think there's wide acceptance around what globally are accepted practices for infant and young child feeding, and I think that they've been broadly accepted, and I think they've worked themselves through various health systems. But I think the risk is really there's a continued risk in the life cycle of a family or of a girl child, in the sense of things will just keep repeating themselves, whether it's obesity or it's whatever it is, education levels. And so I think we need to pay much more attention to the life cycle because it's generational. So you need to, impacting someone at birth throughout, that's great. That's going to give them a leg up. But then how are we helping them all the way through to, higher levels of education? You see infant mortality rates come down. All of those things that are interrelated. And so paying attention to that entire life cycle is something that's really important to me, but also paying attention very early on to that -9 to 0 month time frame when a child is developing in the womb, I think is critical. And so understanding the inter-household dynamics and how to make sure that those nutrition issues are there, and that the women they know all the ins and outs of breastfeeding and latching and all of those kinds of things. I think we've had some issues in countries around the world where, colostrum was traditionally thrown out, right? And you have to start using language around, well, hey, you got to think about that as the child's first vaccination. That is like super nutrition. It's just this liquid that just has everything that you need in it, and then it's being thrown out, right? And so how do you deal with that and make sure that culturally it becomes accepted? And there is a policy response to that. The question is, depending on the system in any given environment, what's the way to get that down to the household level? And that's the challenge.
I want to say that the local narrative is very, very important. So, for example, interestingly, it's always been very interesting for me in the U.S., where among low-income families, you'll find very poor choices in terms of nutrition, definitely lower intake of fresh fruits and vegetables and things of that sort. If you go to other countries, countries like the Middle East, actually fresh fruits and vegetables are part of the diet. So what ends up happening is as affordability goes, people are no longer able to afford all this stuff, debt goes up. Shifts in diets due to not necessarily physical urbanization, but cultural urbanization of the rural areas. So you'll find some shifts that are happening. And so what you find going on, there's an obese mother that's having a malnourished child. And the reason the child is malnourished is because they're giving bread or they're giving whatever is available in order to fill bellies, like, to use the term that you've used. But interestingly, some of the things that we've noticed can potentially happen and gain some linking policy sort of to the local, very household level. One of the things we've noticed in Egypt, they started rolling out the smart card system. And what the smart card system is to be able to be able to track, number one, bread consumption, limit bread consumption, and then on top of that, whatever extra bread you don't use, you can trade that for a point system where you can go for the government outlets and then start purchasing other items. I think there was a project similar to that in the Michigan area where some of the low-income families were going in exchange for some kind of coins and then be able to start purchasing healthier, making healthier choices. So I think looking at healthier choices in relation to economic access is really, really important. So that's one comment I have. Another comment I have is about the international development community and how it addresses the issue of food security, malnutrition, obesity. So sort of reaching out to my background working in international development, but also studying international development and so forth, you find that a lot of the international projects, whether USAID, World Bank, so forth, they operate in actual silos. There's no interaction between the projects. So you will find agriculture projects simply focused on improving productivity for exports, and that's it. Or projects that are focused on education, and that's it. There's no sort of interaction of how you can leverage one project in order to address multiple issues that are going on. Malnutrition is a good example of how to, mother and child sort of programs that went down in funding in so many countries. These are sort of low-hanging fruit in order to start, how can I start teaching mothers not just how to eat, but how to feed their children with the economic access that they have. And I think trying to promote better, more holistic programming on one side can help the international development community start looking at the food security, malnutrition, and obesity not as stovepipes belonging in different areas, but more as one issue interrelated.
Great, two great comments, Gada, reminding us about the ecosystem that Kelly brought up early on. Looking at the clock, I want to bring people in, but I was going to ask one more question that I think came up from your first comment, and I thought is a good way to bring Jean back in. So we've talked about what's the problem, what are the factors driving it, some policy issues, but what is it that we don't know? What are the areas where we really need to focus research? What are the research priorities going forward that can help us deal with some of the issues that you guys have talked about? Do you want to start, Jean?
Start with that. You know, one of them is just that the quality of the data that we have on nutritional status around the world is not great. And a lot of assumptions and estimates go into our estimates of the status of kids and families with respect to food insecurity, and even with some of these important nutrition outcomes, low birth weight, most babies aren't weighed. So that, you know, that's an estimate that we have, that we're working with, of a 15% rate of low birth weight. So there's a lot of measurement issues in there. The other issue that I think we have to do a lot of research on is around the implementation. We call it implementation science right now, seems to be the buzzword. You know, we don't really know how to take great policy and make sure it's implemented the right way in local settings. Because it's different in different places. And I think having more capacity to understand how to translate policy into action and to how to tailor that to specific environments, that's a discipline that needs to be developed more broadly. I think it will tell us a lot about how to take these important policy decisions. Policies can work really well, but they can't work at all well if they're not implemented. So we need to know how to do that.
In the car on the ride over, something about the microbiome research. I wonder if you want to.
Oh, sure, yeah, yeah, thanks for reminding me. Yeah, so another area of research, of course, is that the energy balance issue isn't quite as simple, turns out, as we thought it was. Andrea and I were talking about this yesterday. There's starting to be just tremendous research looking at environmental exposures that appear to predispose to obesity and weight gain. And we probably need to start looking at that more carefully as we think about this as a global problem. So exposure to contaminants like endocrine disruptors that are in plastics and all those baby bottles that I microwaved when my children were little. The microbiome, you know, our gut flora, which are affected by the diets that we eat. They're affected by our maternal inoculation at birth. They're affected by antibiotics that we take to fix infections that we have. We're only now starting to realize that there are consequences for messing around with that. Yeah.
Kelly, you want to jump in on this point?
Well, Paul, there's so many things we don't know and so many gaps.
Yeah.
So I think, to me, the most significant thing about you raising the question isn't so much that we can name what the gaps are, because there's so many of them, but the need to set up a process for answering that question. What are the gaps? And the question is, how do you most profitably address that? And who do you need to bring together in order to do it? And one of the things that we think a lot about as a School of Public Policy is how to create a better two-way bridge between the policy world and what goes on in research. And in the case of, and so one way to look at it is to think about who are the people or the institutions out there in the world who are in a position to do something about a problem. So hunger, sustainability, food safety, whatever it happens to be, and how can you create this two-way flow of information between them and the people who could do the research in order to have the research be as policy relevant as possible. And that's one of the things that we're hoping to do, is have more convenings of that sort, where you bring together people from the relevant groups, so you could create a research agenda that's best capable of addressing those big gaps in knowledge.
So, David, you want the
Yeah.
kind of final word from a practitioner's perspective? What
Yeah,
critical
no,
things do you think you would love to?
I mean, I keep coming back to the whack-a-mole, and I think for me, kind of related to both. There's obviously these scientific questions, but I think the broader question is, what's the research agenda and who's going to come around it globally? And I think I'd love to see a group of people come together and really do a very deep global, we'll create a kind of model that we can use that says, globally, these are the actors and these are the political economies and realities around them, and this is what's going to make them act or not act. Something that could then be used at the national level and all the ways down to the national. What are the incentive structures that are going to force these people or organizations to move in the direction we need them to go in terms of addressing these issues, addressing potential global food shortages and food shocks and price shocks. And it sounds, it's a little more clear in my head than I'm making it sound, but I think it gets back to that whack-a-mole comment of having something that's really holistic and understanding who the actors are, what's going to make them, act on these issues, and what are their responsibilities to those issues. Otherwise, you're going to get pieces of research, and you're still going to consistently have holes.
So I'm going to cheat. I said that was my last question, but I have a burning question in my mind after listening to you and Kelly. The global dialogue at conferences around undernutrition in the last couple of years, the conferences that I've attended and the ones I read about, has tended to be recently about the SDGs. It's all about setting new targets. What do we replace the Millennium Development Goals with? What are the new SDGs? A lot of the dialogue is, well, we have too many. Do we reduce the number? What should the targets be? Is that helpful, or would it be more useful to have the kind of dialogue you're talking about the research agenda?
Well, at the same time those discussions are occurring, there's a whole other group of people who are talking about goals for dealing with obesity. And then there are other people out there who are dealing with the impact of agriculture on climate change. And I think therein lies the problem, that you do end up with the whack-a-mole effect, where the hunger community might be able to think about how to more effectively address hunger, but it might have negative consequences in the other areas. So bringing together people who really understand the various problems in a way they can work together and come out with more coherent food policy might create more win-wins.
Yeah, I'm definitely not going to complain about,
Trying to create controversy here, David.
Yeah, no. The prominence that I think nutrition has, gained over the last, I would say, 10 years or so, through Copenhagen Consensus and all those movements that are saying, look, this is a core determinant of so many other things later on in life. I definitely think that's great, and as we move, beyond the MDGs and into the next range of what those goals are going to look like, I think that's great because it keeps the conversation going. But I think Kelly's point is a good one, in the sense of, well, we talk about nutrition, but what is it, right? Mm-hmm. And to different people, it's different things,
exactly.
right? And that's where the challenge is.
Some final thoughts before we open it up here from Scott or Jim?
Well, I want to say that there's a lot of changes are happening, even in terms of the indicators and how we're looking at food security, food insecurity. Our conversations with the FAO and several other organizations that are working with us in terms of the research we're doing. How is malnutrition the right indicator? Is what child stunting now is being considered as the right indicator. So there are lots of things that are changing. I think in terms of the research, there are lots of gaps. Data, when you start going especially towards low and middle income countries, is really important, but it's not easy at all to get the data. You can find some high level data, but to go lower into other types of data that you need. One of the things that came up in the research over and over again, and maybe because we do GVC value chain research and try to identify the actors and institutions and so forth and try to understand what their role is, but it's really hard. It took us 3 years to get to where we are, and that gives you an idea of how hard it is to bring this material together. But I think information about the actors, the companies, their role in these types of activities is really critical, and we don't have anybody really doing this work.
What's your big closing point for us to remember? Let's start with David. I know him the best I can.
Yeah, thanks. Right. Look, I think that we all have come from various different experiences, and I think we've been talking in kind of these big global generalizations. I think that for me, what's very important is that while elements of these issues exist everywhere around the world, it's very, very important to research, explore, and evaluate what the issues are in varying contexts. And I mean, generally for me, it's you know, higher income, middle income transition, and lower income, and you can go even further and say weak or unstable as well, and some of the shocks that go on there, and really understanding what the challenges are in each of those environments, to me, is going to continue to be a priority. And the last thing that, I mean, personally, that I just think is very interesting was the comment I mentioned earlier about really looking 100, 150 years ahead. If we're, you know, we're dealing with some pretty serious global problems, and you know, we're talking a lot about climate change right now, and I don't think we're talking enough about food policy and food. And I think it's a combined issue, but it's also just as urgent. And I think if we're not starting to think ahead of the current problems that we have, 50 years is nothing.
Be playing catch up.
Yeah, right.
Jean or Goddard, do you have final thoughts you want to share?
Sure. Yeah, thanks. So I think the thing I would say is to this group of academics is that don't get in your own way, in the sense that I think the research community has a lot to offer in this sphere, but I think we have to partner with policymakers, we have to partner with advocates, and we have to partner with service providers, and somehow do that without losing our ability, our unique ability to be objective and rigorous about collecting and analyzing data. But I think those partnerships are essential because these are very complicated problems, and just having the knowledge and information is not going to fix them.
Great. Boy, you get the final word now.
Well, in a recent visit that we just had in DC, one of the individuals who we met with mentioned a very important thing. He said, like, at least when you do enough research early on, before you start actively implementing a project, the chances of making this project successful increases by 20%. And he was being very modest by that. So this means what? This means that by understanding the local context, the dynamics, from our perspective, unpacking the value chain, understanding who does what in these things that we are working with, and what are the right leverage points, understanding how these leverage points can impact other nodes in the system is very critical before we start taking some kind of action, and then midway or 3 years down the road, we have a big, oops, this is a problem. This is very interesting as we look into higher incomes now in many countries. Did not mean greater food security, and it did not mean better health. It actually continued to mean food insecurity, and it also continued to, these countries also continued to suffer from health issues in relation to malnutrition, obesity, and child stunting, and so forth. So I'm hoping that as we look at these challenges, we start taking more of a holistic, more of a systems approach to see it from input-output kind of basis, and looking at food security and nutrition as outcomes. They're results of all these activities that happen beforehand.
Thanks for summing up. I hope, I guess we're a minute or two over, but I hope that isn't too much of a problem for the next group. And great pleasure to moderate this panel. Please join me in thanking the panel.